Hey, good evening, everybody. My name is Dr. Nathan Thompson with Exemplify Health Center, your Wellness Way affiliate right here in Yorkville, Illinois. Happy Monday evening, guys. Hope you guys had a great weekend. Welcome to Looking at Cancer Differently, Part 3. Today we're going to talk about the best cancer cure that's out there. I know that a lot of people, they'll message me and they'll say, hey, this cures cancer, this cures this cures this. And guys, I want you to tell you, because I know if you watched Part 1 and Part 2, really when you look at cancer, it's a multi-system, multifactorial issue that is going on. And it's never just as simple as, hey, I took some CBD oil and all my problems went away. And if anyone is telling you that some secret herb or some secret formula, some secret fruit, that was just recently discovered way in the Amazon rainforest and it's going to fix all of your problems, I'm going to tell you, you are going to be disappointed because yes, there are certain things that do have benefit, but guys, there's always more than one issue. More than one thing has to go wrong in order for someone to be diagnosed with cancer. And guys, just like I said, you can chemo it, you can radiate it, you can poison it, you can cut, you can burn it. You can do all of those things, but if you never change the physiology that brought it on in the first place, the only thing those things are doing is buying you time. But yes, and many times it actually will make you worse, even if your numbers are looking better. Because the very thing that it does is actually hurt the immune system, which is the very thing that will prevent cancer from coming back. So people ask me, what is the cure for cancer? And I'm going to show you at the very end, kind of tongue-in-cheek, but I'm going to talk to you guys, especially if you've never had it before, or you're saying, hey, what can I do in order to prevent it? I'm going to show you some very specific lab markers and some pretty awesome research that's going to tell you whether you are heading that way or not. The reason why I say this, guys, is I really think that there's already an epidemic of cancer that's going on. But I think over the next 20 to 30 years, and I hate to be the bearer of bad news, but I think it's going to continue to get worse, and I'm going to show you why, based on where the average American is headed when it comes to a lot of the lab work that I see, but also some of the things that we are doing to try to quote-unquote prevent disease. So let's look at Cancer Differently, Part 3, the best cancer cure. If you guys are watching me right now, make sure that you say hello. Make sure that you let me know where you are watching from. Hello, Canada. Hello, people from the United States. Hello, New Zealand. Hello, Australia. Hello, Europe. We have people from all over the world that watch. Please let me know that you're watching it. And guys, if you find this useful, please, please, please make sure that you share this to your timeline, that you share this in a message, you share this with other people. We will also be uploading this in case it always gets deleted to our different platforms. So if you ever need to see a past video, it will be on YouTube as long as it doesn't get taken down. Usually at about 100,000 views, YouTube will take down all of my videos. That's why we also have it on the Rumble platform. And guys, you can also follow me on different video formats. We are on TikTok. Currently, we have a video about the gallbladder that is approaching 2 million views. You would be amazed at how many people suffer with gallbladder issues or have had their gallbladder out and suffer digestive issues afterwards. We explain that why. You can also follow me on Instagram, a little bit more lighthearted platform. So I'll post a lot of things in regards to working out and just everyday life. And then also True Social, emerging platform, which is really awesome. They don't censor at all. Things like their counterparts Twitter tends to censor quite a bit. And so you can follow me on those other pages as well. Look forward to seeing you guys there. And then guys as well, if you guys are watching from different parts of the country, don't forget to go to thewellnessway.com. This circle that I see up here, if you want to consult a doctor, you can find a clinic in your area right here, or if you need to consult a doctor via telehealth, a phone consult, or whatever it might be. There are other doctors who will have the time and who will have the sometimes the energy. But I know for us, I was looking at our console schedule coming up, and it is completely booked for about the next 6 weeks. So if you guys need help, I want to make sure that you guys are getting the help that you need. So make sure, guys, that you please go there. And then also watch my good friend and mentor, Dr. Patrick Flynn, every Saturday morning at 8 o'clock. He does a fantastic show. It has been banned, I think, off of Facebook, but he hosts this on his own platform called A Different Perspective, 8 o'clock every Saturday morning. Absolutely awesome, and goes over a lot of the same topics that I go over. So please make sure that you are watching that on Saturday in order to expand your knowledge and be able to improve your health. So guys, make sure that you are doing that rather than reach out to me specifically, because I'm going to tell you. Please go to wellnessway.com and you can find a clinic that's near you, or you can actually consult with the doctor one-on-one if you've got any questions regarding past lab or current labs or labs that you need in the future and down the road, okay? So let's get into looking at cancer differently, part 3. I'm going to try to move as quickly as possible, guys, because, man, when I was doing this, I went down a rabbit hole, and there's just so much research just on some of the things I want you guys to make sure that you're paying attention to. And, guys, there are probably some other things that I could have included as well, but for the sake of time and the sake of trying to be brief, I'm going to go over some of the most important things that I think that you guys should be paying attention to, especially when it comes to preventing cancer, obviously down the road. Maybe even if you've already had cancer, you'll find benefit doing this, listen to this too, because, the whole thing is, oh, they got all the cancer. No, they didn't. They never get all of the cancer. And besides that, what has the doctor told you to do in order to begin reversing the physiology that brought the cancer on in the first place? Okay. Now, the first thing that I want to talk to you guys about is something that your doctor, your regular doctor, maybe your real doctor, your MD, your PCP, primary care physician, general practitioner, something that they are not measuring really at all. I don't see them measuring it when people bring in past lab works. And this has to do with your insulin, okay? So doctors don't measure insulin. What they do is they'll measure blood glucose, or maybe some doctors will measure A1C. And blood glucose is a measurement right at that moment of what your blood sugars are. A1C is almost a 90-day average of what your blood sugars are averaging over the last 90 days. But guys, by the time that your A1C is elevated and you're now pre-diabetic or full-blown diabetic based on an A1C marker, you could have caught this way before by measuring something that's much more important, and that's your overall insulin levels. Insulin is a fat-building hormone. Insulin is basically what helps to shuttle sugar into the cells and actually help sugar to get stored as fat. So if you are developing something that is known as insulin resistance, meaning you don't hear insulin the way that you are supposed to, you'll see your insulin levels climb in order to achieve the same effect in order to keep your blood sugars at a normal range. So this is why when you are losing blood sugar control, you should have checked your insulin a long time ago. I will also say this, guys, is that type 2 diabetes, insulin resistance, and things like that is actually a protective mechanism of the body. And the reason why is that if your body shuttled all the sugar into the cells that you were consuming every single day, those cells would achieve so much oxidative damage that they would die off a lot quicker. So one of the things that the body does is become insulin resistant and then move it over to fat in order to protect those cells from a high amount of oxidative damage. Because guys, I will tell you is that sugar is a very efficient but also very dirty fuel, and it can produce a lot of oxidative damage. So let's go to PubMed. Where do we get this at? From PubMed. Yes, I did a simple Google search, but PubMed is a division of the National Library of Medicine, the National Institute of Health. This is all peer-reviewed journals, and this one comes from 2003, Integrative Cancer Therapeutics. So in what they talked about was insulin, guys, and cancer. Insulin and cancer, and here's what they said. Recent evidence supports the role of insulin and insulin growth factor as important growth factors acting through the tyrosine kinase growth factor cascade in enhancing tumor cell proliferation. In addition, the metabolic syndrome associated with chronic inflammatory state and accompanying a cytokine abnormalities may also contribute to tumor progression. So what are they saying here? Is they are saying a high insulin environment actually promotes the growth of tumors. Guys, if you actually want to put on a lot of muscle, eating a high sugar diet will actually do that. But the other thing that comes with that is also an increase in growth not only in muscles, but potentially in tumor cells. It will also come in a pro-inflammatory state, which is why, guys, when you see the people who have the highest amount of muscle, take power lifters, for example, is that they're always inflamed and they're always dying from heart attacks at 55 years of age. Because of their consuming so much sugar, you can actually just see it on their face how much inflammation that they actually have. So here's what they say is that insulin and cancer can contribute to the progression of tumors, okay? Here's another one. Insulin, insulin receptors, and cancer. Here's what they say in this article. This comes from a review back in Journal of Endocrinological Investigation 2016. It is known that many cancer cells require insulin for optimal in vitro growth, which means if they're going to grow cancer cells, they need insulin to grow that in a test tube. What they further say is that all conditions of hyperinsulinemia, meaning too much insulin, both endogenous, which means from within the body, which would include things like prediabetes, metabolic syndrome, obesity, type 2 diabetes, before pancreatic exhaustion, because yes, you can develop type 2 diabetes and you can exhaust your pancreas into the point where it can't produce any more insulin, in which now you are a type 2 and type 1 diabetic due to pancreatic exhaustion, and also polycystic ovarian syndrome. So if you guys look at ladies with polycystic ovarian syndrome, you're going to historically see very, very high insulin levels. And in fact, I've seen those levels up to 49, up to 60 in very young women. It will also be able to, the other conditions that it includes is exogenous hyperinsulinemia in type 1 diabetes. And yes, guys, just because someone has type 1 diabetes and they can always lower the blood sugar by taking insulin from outside in an injectable form of insulin, it doesn't give that person license to do whatever they want, because you still can then be a type 1 and also an insulin resistant type 2 diabetic. So it actually can work as being a type 2, then becoming a type 1 due to pancreatic exhaustion, but you can also be a type 1 due to an autoimmune condition, which is pancreatic destruction, and then also become a type 2 insulin resistant diabetic as well. What they further on to say is its detrimental effect on cancer incidence and mortality is well documented. So we know it's well documented that having elevated levels of insulin promotes the growth of tumors and cancer. MD Anderson, a cancer center, said, how does insulin resistance affect cancer risk? What is insulin resistance? Meaning you don't hear insulin anymore, which you need elevated levels of insulin in order to lower your blood sugar. But they said resulting weight gain, inflammation, and hormone disruptions raise your risk for up to 13 different types of cancer. So just insulin resistance will raise your risk for up to 13 types of cancer. Which, guys, this actually proves my point, is that no one should actually say, I had no idea that I was going to have this cancer. It came from nowhere, because they're showing that once you start to see your insulin levels start to elevate, then you're a perfect candidate for having cancer. It just so happens that the doctor is not teaching you about this. It just so happens that they're not measuring this with the right testing, and it just so happens they're not saying anything about your lifestyle. In fact, many times we have cancer patients come in, I say, what did they tell you about diet? What did they tell you about lifestyle? What did they tell you about nutrition? And they say, it doesn't matter. And the reason why is because they come from a place of saying everything is genetic, it's none of your fault, which also means there's nothing that you can do. And it leaves that person sometimes happy because they said, oh, there's nothing that I could have done. There's nothing I could have changed. Guess I got a stroke of bad luck. Or it leaves them hopeless, meaning I guess there's no change that it actually can make. That's why I will always go back to the point, guys, that if you believe that everything is genetic, it's either going to make you feel helpless and hopeless, or if you have bad genes, or it's going to make you really, really lazy if you feel like you have good genes. Meaning, I got good genes, there's nothing that I need to do, or I have nothing but bad genes, I guess there is nothing that I can do. So guys, it is in your power, it is in your control, and I always say this, even if it's only 5% your fault, taking 100% responsibility can make you 5% better, and sometimes that can be the difference between life and death. Here's another article from PubMed. It says, insulin resistance and cancer risk. an overview of the pathogenetic mechanisms. Interesting how they say that insulin resistance and cancer risk actually changes your genetic expression and changes the genetic mechanisms towards cancer. So here's what they say. Another mechanism that fuel cancer growth and tumor progression in low-grade chronic inflammation and insulin resistance is the accumulation of damaged DNA. So imagine that. Maybe when people say it's genetic, I always say, well, what caused the genetic changes? There has to have been some kind of oxidative damage, even if you passed on the oxidative damaged genetic material to your offspring. This is one of the reasons why is that you can actually pass on genetic issues based on the health status of a woman and of a man at the time of conception. So take a man's sperm and his health status at that point, take a woman's egg and the health status of that point, also look at their liver health as well and methylation issues and things like that, and their toxicity levels. All of those things are going to influence the health of the baby in development and also being born. So they say that it actually will cause damage and accumulation of damaged DNA caused by low-grade inflammation and is insulin resistance. They further say hyperglycemia or increased blood sugars in insulin resistance increases what's known as advanced glycation end product formation. The production of intracellular advanced glycation end stages, precursors, damages target cells by modifying proteins and altering their function. So it's a lot of words, but basically what they are saying is that when you have high blood sugars, you have high amounts of insulin, is that it causes DNA damage, and what you get as an end product is advanced glycation end stages. We call those AGEs. This is what's amazing, is because yes, it could damage the DNA, leading to tumor formation, but now watch this. This is why having increased insulin in the body causes so much more damage than even just cancer. I want you to look at this, okay? So let's look at what these advanced glycation end stages actually cause. Number one, they're going to cause problems and changes with the eye lens. This is known as cataracts. So when someone says, I have cataracts, I guess I'm getting old, I say, no, you have hyperinsulinemia, and you have elevated blood sugars, and that's causing advanced glycation end stages. That's damaging the lens, and that's why it gets cloudy, and that's why it's called cataracts. This is why if anyone has any kind of cataracts, my goodness, they should be checking them for type 2 diabetes, and they should be checking them for insulin resistance. So this is why it causes cataracts. Not only that, but these advanced glycation end stages are going to damage anything with any kind of soft tissue, which is also going to damage the lining of the blood vessel, which is why when people have increased and elevated insulin, this is why they have arterial plaquing, this is why they have high blood pressure, this is why they end up with heart attacks and strokes. Not only that, it will cause changes in the skin. This is why if you have hyperinsulinemia, this is why you will age faster in your skin. This is why you look at someone who's a type 2 diabetic, why they look older on the outside. This is also why a lot of people don't understand, if you want to look younger, quit putting so much stuff on your skin with eye creams and B vitamins and special lotions and special potions, because the health of your skin is really coming from the inside out. You want healthier, you want younger looking skin, then check your insulin levels especially. It can also change issues within the bladder and also within the prostate, and it can also cause changes within the joints, within the cartilage and in the joint capsules. So what it can actually cause is destruction, for example, of the knee, not only of the meniscus, but also of the articular cartilage and of the joint capsules. Guys, this is what just absolutely floors me, is when someone is a type 2 diabetic and they're going in and they're saying, yep, I guess it's old age, I'm 55 years of age and I need a joint replacement. I got bad shoulders and I got bad knees. And I'm saying, yeah, but this guy over here is 55 years of age and he doesn't have bad knees. And by the way, he's actually exercised more. I think one of the next topics I'm going to talk about is the whole idea behind joint pain, and this whole idea about like I'm just getting older and it's destroying my joints. Guys, if you want healthy joints, check your insulin levels, please. Check, and see what your blood sugar levels are at, but ultimately it comes down to your insulin levels. And the other thing it comes down to is your overall inflammatory levels. And the other thing it comes down to is alignment and using joints. The whole idea is that you will get stiffer if you don't use your joints, which is why I always tell people, they say I have bad knees, and I say, great, move it. Move it more. The whole idea behind taking it easy on joints as you fade into the night, as you get older, is one of the most ridiculous things that I've ever heard, because if you're older, you should be moving more. I mean, look at the people who say, I'm going to move less. I'm going to take, the mobility vehicle or the scooter at Disney World, and I'm just going to ride around. Well, at that point, it's never ever going to get any better. And this is why when people go from, I'm going to stop moving, I'm going to stop squatting, I'm going to stop picking things up, I'm going to make my life easier, this is why they go from the walker to the wheelchair to the grave, because they stop moving and those joints actually don't become healed. They actually continue to get worse, which is why movement is essential for life. It all comes down to insulin, it comes down to inflammatory levels, it comes down to the joint alignment, and it also comes down to whether you're actually moving it or not. So look at this. So insulin not only can fuel cancer, but now you're talking about things like arthritis, you're looking older, arterial damage leading to heart attack and stroke, and even changes in vision known as cataracts, okay? Now this one here, the insulin receptor, a new target for cancer therapy. So now they're saying, well, what if we're targeting the insulin receptors in regards to cancer treatment? So here's what they say. This was published 11 years ago. The insulin receptor pathway is more directly and intimately involved in cancer development and progression than previously thought. They further on went to say, type 2 diabetes mellitus and other conditions associated with insulin resistance such as obesity and metabolic syndrome are now recognized as important risk factors for the development and progression of a variety of malignancies or cancers. Anti-diabetic therapies has rapidly gained attention as a novel target in cancer. Imagine that. Now, what they're saying is wow, maybe we can actually slow down the progression of cancer by using these type 2 anti-diabetic drugs like metformin, for example, which just goes beyond me, because they're always trying to find a drug solution when there's actually a natural, I don't even want to call it natural, it's a common sense approach to overcoming type 2 diabetes. Because what they're saying is wow, we can slow this down by lowering a person's insulin levels, and we can slow down the development and the progression of cancer. And this is why when you get into insulin resistance, we could talk about this for 6 hours, about the different things that can cause insulin resistance. Yes, it can be because of the overconsumption of processed sugars. Yes, it can be due to issues with the liver, especially with fructose and high fructose corn syrup. Yes, it can be due to hydrogenated oils and problems with the liver. Yes, it can be actually due to a short-chain fatty acid production issue within the large intestine. And yes, it can be actually due to too much mental stress, which puts your body into fight or flight, which is going to chronically elevate your blood sugars. And yes, it could also mean that you just have really bad amount of muscle mass, and you need to start sensitizing those receptors by increasing the need for them, by increasing muscle mass. So there's a lot of different reasons why, but it's interesting that they're looking at anti-diabetic therapy as a novel approach to helping with cancer. How about we just get back to what caused it and fix that, versus trying to find new and novel drugs to try to help with really type 2 diabetes, but now they're going to tout it as anti-cancer type therapies and things like that. So the first thing that I want you guys to understand is you guys need to start measuring your insulin levels. Please start measuring your insulin levels, and it needs to go deeper than just measuring blood sugar, and it needs to go deeper than measuring your A1C. So if your A1C is already going to be above 5.7, you're already pre-diabetic at that point, which means your insulin levels are going to be really elevated and you're already going to have insulin resistance at that point. You've already started the process of becoming type 2 diabetes. And just like with cancer, I say, well, when would you want to start working on it? When you are type 2 diabetic, or if you're pre-diabetic, or would you rather start it if you already had the physiology, that it was not a matter of if, it was just a matter of when it was going to happen. So your insulin levels ideally should be 3 to 5 international units per milliliter. That is a low level of insulin. So I've measured my insulin. Last time I checked it, I was at about 5, which means that not only I was not consuming a whole lot of sugar, I was extremely insulin sensitive, which means I didn't need a lot of insulin in order to shuttle it into my cells to use the sugar as a usable source of energy for the cells. So here's a person whose insulin levels are at 50, okay? So the levels are at 50, and so one of the interesting things is that she wasn't even considered diabetic at that point, yet her insulin levels were twice the upper limit of where they were at, and I would actually say they were 10 times of what they should be. Now, this individual has polycystic ovarian syndrome, which is almost always marked by high levels of insulin resistance, okay? Which is also why insulin plays a big time role in your fertility cycle as well, especially with ovulation. So you guys need to be measuring your insulin levels and not just measuring blood sugar and A1C. Number 2, here's the second thing, is inflammation and cancer. We do inflammation talks all the time. We talk about, yes, inflammation is the spark that can lead to the development of cancer, thyroid issues, weight loss resistance, hormone issues, Alzheimer's disease, type 2 diabetes. Yes, there is a role of inflammation plays in all of those. So in Nature 2002, they said inflammation and cancer, and here's what they say. Inflammation is a critical component of tumor progression. Your inflammatory levels systemically are a critical component of tumor progression. Many cancers arise from sites of infection, chronic irritation, and inflammation. We went over this in part 1. So we talked about there's different reasons why cancer develops inside a person's body. Sometimes it can be due to having an infection, Epstein-Barr virus, the HPV infection. It can be due to certain viral infections, no doubt about it, but it can also be due to chronic irritation. Even if you look at things like stomach cancer, if you look at esophageal cancer, you look at colon cancer, this can actually arise as the body trying to change the tissue structure to protect it from eroding away, and so it will become resistant into a much more harsh environment that it's chronically exposed to, which then furthers the development of cancer, which is fascinating when a lot of people say that cancer is an adaptive protective mechanism, even though eventually it will kill you. If you didn't adapt into those type of cells, you would die a lot sooner. And so also with inflammation. So they're saying that it's not just genetic and it's not a bad hand, and he didn't just play Russian roulette and he happened to, be the unlucky 1 out of 6, is they are saying time and time again that it's insulin, that it's inflammation. And then the third thing that I'm going to go over, and any doctor that continues to say there's nothing that you can do, it's just was given a bad hand, please do me a favor and please find a different doctor who is willing to actually look up PubMed and take 20 minutes to start finding these articles that are easily and readily available. So I want you to look at some of these cancers and to see actually where they arise from. If you look at, all right, lung carcinomas, okay, this can be due to inhaling silica, asbestos, and smoking, okay? One of the pathological conditions that precludes that is chronic bronchitis. See, your body is leaving you clues. Your body, let me say it again, your body is leaving you clues. It's not that I've had bronchitis and lung inflammation for 10 years and all of a sudden I guess I just got cancer. Your body will always leave clues. How about having a pancreatic cancer, a pancreatic carcinoma? What causes that? Alcoholism. You can have changes due to alcoholism in specific genetics as a result. but you'll have a history of chronic pancreatitis, okay? Look at melanoma. So melanoma, or skin cancer. So what's the agent? Ultraviolet light. I don't think that that's the only agent, but this is why I was talking to a person. You need to go out into the sun more. They're like, yeah, but what about skin cancer? And I say, well, you should never go out and get burned, but have you ever known someone who got skin cancer, and where they got the skin cancer was actually on their butt cheek, all right? I know I'm not talking like a doctor right now, but you've noticed people, they get skin cancer under their arm, or they get skin cancer on their belt line. Things that the sun has never ever seen, yet they're getting skin cancer in those areas, or on the very lowest part of their back. So remember, there's always it can be a different reason than just having too much sun or getting sunburnt, okay? But you're going to see that people who have a lot of skin inflammation systemically are also going to have a higher risk of having a melanoma. And there's other reasons that can cause skin inflammation with things like psoriasis, rosacea, and other skin conditions. Then you have things like gallbladder cancer, gastric adenocarcinoma. What's interesting is that you're going to have chronic gallbladder inflammation, you're going to have ulcers, you're going to have gastritis or stomach inflammation that precludes that. And so one of the reasons why is actually for the stomach is having an H. pylori infection, which, guys, it's one of the reasons why people get ulcers. And did you know that you can overcome an H. pylori infection in about 2 to 3 days? And you don't necessarily need to be on antibiotics for it. The reason why this bacteria starts to cause an infection is that it's always in your lower part of your stomach. It's because you don't have enough stomach acid, and it will start to crawl up into the main part of the stomach, and it will start to overgrow only because there's just a better environment for it, okay? When you look at things like B-cell non-Hodgkin's lymphoma, Burkitt's lymphoma, here's the thing, is that one of the precluding things is having mononucleosis that's caused by a viral infection, which is known as Epstein-Barr virus, okay? Now, Epstein-Barr virus not only can cause things like non-Hodgkin's lymphoma, Epstein-Barr virus is one of the main reasons why people will have Hashimoto's thyroiditis due to a chronic infection, and that virus can start to infect the thyroid cells, and the immune system says, you don't belong here anymore. We need to destroy the thyroid cells in order to get rid of the infection. And so just remember, guys, even with autoimmunity, it's never the body attacking itself, which is why we have such a high success rate with autoimmunity, because we look at it from a different perspective. So this can be due to chronic inflammation. So the second thing I want you guys to measure is start measuring your chronic inflammatory levels. How you measure this is high sensitivity C-reactive protein, and it should be under 1 milligram per liter. Now, if you look at this same person that we talked about insulin levels being at 49, you look at her C-reactive protein levels, and they are at 7. So very high inflammatory markers, very high systemic inflammation. We have measured people as high as 28. And guess what? This person has had cancer as well. When you have those high levels, not only is it a great cardiac risk indicator, but it is also a great cancer indicator as well, because cancer will adapt in a high inflammatory environment. And here's the third thing that we want to talk about is your immune system. It's your immune system. So, roles of the immune system in cancer, from tumor initiation to metastatic progression. So here's what they say. While chronic inflammation has an important role in cancer, less is known about the impact of acute inflammation on tumor progression. Here's where it gets really interesting. For example, inducing acute inflammation locally in the bladder with a vaccine containing an attenuated Mycobacterium bovis strain successfully treats squamous cancer of the bladder. Okay? Hence, with the infiltration of leukocytes and subsequent inflammation, the impact from inflammatory mediators can both initiate and, in certain cases, eliminate tumor cells and prevent tumor development. Immunodeficient patients are more often diagnosed with cancer. So one of the things that they actually said, and the doctors are looking at now, is they're saying, okay, well, chronic inflammation is bad, and yes, it is, but we in our society, and acute inflammation is actually good. So one of the things that they found is hey, wait a second, maybe if we can induce an acute inflammatory response at the site of cancer, that can actually cause the recruitment of certain cells to destroy the tumor. And here's where we have it all wrong in the United States, guys. Please share this right now, because I'll tell you where we have it completely wrong, is that in the United States, we actually try to inhibit acute inflammation, and we do nothing when it comes to chronic inflammation. I want you to think about it. The body is either smart or it's dumb. It either never messes up or it's always messing up. For example, if you get a sprained ankle and it gets red, it gets swollen, it's hot, we're said you got to ice, you got to rest, you got to compress, you got to elevate. And in fact, you're doing everything what the body wants to do in order to heal it. If you get a sprained ankle, you actually should let it swell up. You should try to move it safely as much as possible. And you should let that thing get black and blue as much as possible. Because when that happens, you get the tissue damage. It's the swelling that brings in the immune system to immediately start healing and protecting that area. And when you ice it and you try to restrict it, then what you're essentially saying is I don't want the immune system to go in, which is a perfect recipe for having a lot of chronic ankle sprains, which is what I had growing up, and it eventually, resolved itself when I had to get a complete joint reconstruction in my ankle at 19 years of age. So what they're saying is that acute inflammation, actually recruiting the immune system, has an amazing effect on actually destroying tumor cells. And they also say if you're chronically immunocompromised, that's also a great recipe for cancer progression as well. Roles of the immune system in cancer, from tumor initiation to metastatic progression, what they further go on to say is they talk about different types of immune cells, one of them being natural killer cells. Natural killer cells have a well-documented anti-tumor effect. In this regard, the presence of natural killer cell infiltration in colorectal and gastric tumors correlates with a favorable outcome. Meaning if they find the presence of natural killer cells, they say, hey, you're actually going to be okay. You're going to be a lot better than if we don't see these specific immune cells. Hence, there appears to be an intricate link between incipient tumor transformation and the ability of innate immune cells to be able to recognize it. These data highlight the importance of natural killer cells' function in controlling cancer progression. Let me ask you a question. If you're diagnosed with some kind of cancer, are they measuring your natural killer cells in order to see what kind of outcome that you're going to have? Natural killer cells, have you ever heard of them? And is your doctor measuring them? Now, the roles of the immune system in cancer, from tumor initiation to metastatic progression, now they talk about T cells. A high level of T cell infiltration in tumors associated with a favorable prognosis in melanoma, and breast, and lung, and ovarian, and colorectal, and renal cancers, and gastric cancers. CD8 T cells are the most prominent anti-tumor cells. Meanwhile, the CD4 T helper cell promotes not only T cell priming and activation and cytotoxicity, but also the anti-tumoral activity of macrophages and natural killer cells, and an overall increase in the presentation of tumor antigens. Guys, when you study the immune system, your immune system is not just one type of white blood cell. You have many different types of white blood cells that are doing a different function, from things like macrophages to CD4 to CD8 to natural killer cells, even neutrophils, which are responsible for tissue cleanup. Because the reality is that if you did chemotherapy and you killed off the tumor, if you don't have enough neutrophils, you don't have enough cells to actually clean up the dead tissue as well. The presence of tumor-infiltrating CD8 cells and Th1 cytokines in tumors correlates with a favorable prognosis in terms of overall survival and disease-free survival in many malignancies. So what did we go over here? We went over natural killer cells, CD8 cells, CD4 cells, and also B lymphocytes, which are actually producing antibodies. So you look at those different things and you wonder, if someone has cancer, or if you say, hey, I'm interested in staying cancer-free my whole life, what would a doctor say? They would say, you should eat healthy and exercise. What? No. Specifically, what kind of markers do I need to be looking at? What should I be measuring every single year? And what should I be doing as far as my lifestyle to make sure that I never get it or I severely lower my chances of ever getting it in the first place? Or heck, if it's genetic, what do I need to do to make sure I'm not turning on those genes to cause it to happen in the first place? Okay? So, think of this. Molecular base is the potential of vitamin D to prevent cancer. The reason why I'm talking about this is because vitamin D performs over 1,500 genetic functions inside the body, but vitamin D is tied to your CD4 helper T cells, which are basically the general that is coordinating an adaptive immune response specific to your CD8 cells. Here's what they say. Studies show an inverse association between sun exposure, serum levels of 25 OH vitamin D, and intakes of vitamin D, and risk of developing or surviving cancer. So when they say this, what they're saying is the higher sun exposure, the higher levels of vitamin D, the lower your risk of actually cancer. A significant number of individuals have serum vitamin D levels lower than what appears to protect against cancer. Medically, they'll say it needs to be over 30, which means you could be at 32 and you could, they could say, yep, your vitamin D levels are just fine. But in reality, one of the things that they say in this article from, 2008, they say 75 nanomoles per liter will offer significant protection, protective effects against cancer of the breast, colon, prostate, ovary, lungs, and pancreas. Okay? So they're talking about having 75 nanograms per deciliter, but how many of you have gotten your vitamin D levels checked? So we have seen people as low as 4 on it, and they are a recipe for cancer. Most people that we check when they're coming into the office are usually sitting around 20 to 30, and in reality, they need to double or even triple those things. We just measured someone having a lot of hormone issues. We retested hormones, we retested vitamin D levels, we retested some other lab markers, but basically her levels went from being at 31, and when we retested, they were close to 90, and no, that is not too high, by the way. So they're saying at 75 can offer a significant protection. And that's just looking at vitamin D. But what if you started learning how to control your inflammatory levels? What if you started learning about how to control your insulin levels? And you can see that every single time that you do that, you empty the bucket of having a future diagnosis of having cancer. Okay? Now, we talked about the immune system. But guys, like I said the very, very first time in part 1, they said ultimately cancer is going to be due to a failure of the immune system. So do you have immunodeficiency? We quickly learned over the last 2 years who was immunodeficient, because these were the people who absolutely got run over and bowled over by COVID. Now what's interesting is what was one of the comorbidities? One of the comorbidities was having type 2 diabetes and insulin resistance. Now you guys are starting to make the connection between the two. So when you look at immunodeficiency, yes, it can be related to your lifestyle, but I will actually tell you is that sometimes immunodeficiency is medically induced. And when they talk about in this article, secondary immunodeficiency, meaning it's coming from outside sources, they talked about the administration of steroids that has direct effects on immune cell traffic and functions. Okay? So T cells are more affected than B cells. So the tumor suppressing cells are more affected than the B lymphocytes. Cytokine synthesis is inhibited. Remember, cytokines aren't necessarily bad because they are needed, especially in acute inflammation. And they just said that it actually will help in overcoming cancer, especially inducing an acute inflammatory response. So actually, your doctor could be making you immunocompromised, especially if they're putting you on long-term steroid use for autoimmunity. Rather than find the reason why you have autoimmunity and what the triggers are and the things that are actually causing the immune system to work that way, they'll just put you on steroid medications indefinitely for the rest of your life. And you can actually look at any commercial that you see when you're watching TV and here comes a commercial for some kind of immunosuppressant for some kind of rheumatoid condition, some kind of autoimmune condition, and they'll say long term, this is going to cause cancer. And the reason why is because the T cells are affected, and those are the tumor suppressing cells. It can also be due to nutrient deficiencies. So these are associated with an impaired immune system. So this will affect cell-mediated immunity, antibody production, phagocytic production, complement system, and cytokine synthesis. And so what are some nutrient deficiencies, guys? Well, things that require zinc, iron, other micronutrients. So, and guys, this can be absolutely destroyed when you don't have enough stomach acid. So this is why people are like, man, I consume all this stuff all the time. And I'm like, yeah, but how's your stomach acid production? Are you taking a PPI, proton pump inhibitor, for acid reflux? So when you look at this, when a doctor says this, your nutrients play no role in cancer, well, they're just saying that, yeah, your immune system, if it's low, is going to lead to cancer development, and also having nutritional deficiencies can make you immunocompromised. And then also obesity, okay? So obesity will cause impaired immune responses, altered natural killer cell function, and also cytotoxicity is compromised, the ability of phagocytes to kill microorganisms, okay? Which is why when you look at people with hyperinsulinemia leading to type 2 diabetes, usually if they don't die from a heart attack or a stroke or they die from kidney failure, they're probably going to die from an impaired immune response, usually due to some kind of bacterial infection, okay? So number 3, measure your lymphocytes responsible for tumor suppression. Natural killer cells, B lymphocytes, your CD4 and your CD8 cells. So is your doctor performing an immune panel on you every single year? Because just imagine this. What if a doctor said, we're going to run a panel and look at where, if you are trending towards the development of cancer, let's run your insulin levels, let's run your vitamin D levels, let's run your C-reactive protein levels, let's do an immune panel, and let's look at your tumor suppressing cells, make sure that they are abundant. And if they are off, hey, let's fix these so that we're not ending up down the road with cancer. But just remember this, no one is interested in that. Doctors aren't interested in it because there's more money in the treatment of someone with cancer in the last 4 weeks of their life than there is trying to help a person to prevent them from having that instance where they are dumping out hundreds of thousands of dollars in the last 3 months of their life, desperately trying to live just another 6 to 8 weeks in hopes of maybe the cancer will go away, when in reality it won't, because guys, the definition of insanity is doing the same thing over and over, and somehow you're going to expect some kind of different result. Well, let's try this. We're hopeful that this is going to work. It's not going to work because you're not changing the physiology that brought it on in the first place. So when you look at this person here, you can see low CD4 helper T cells. You can see low absolute CD8 cells. You can see low B lymphocytes. And you can see that the natural killer cells were actually okay, but 3 out of the 4 that's really responsible with cancer progression, you can see that he's already low. And oh, by the way, this person had already had colon cancer. So he went through the treatment, he went through the removal, he went through cut, he went through poison, he went through burn, but at the end of the day, this very thing that's responsible for helping this not to come back was actually still considered impotent. So guys, it's not a matter of if cancer is going to come back, it's just a matter of when. And when these numbers are low and you continue to produce oxidative damage, then all that's happening is it's just going to come back. It's just, to say it's not is just some kind of pipe dream. And it's really time for that all of us start to look at ourselves in the mirror and saying, hey, is my bad behavior fueling cancer? And when we're willing to take 100% responsibility for our lives, 100% responsibility for our future, it is then, and it's only then, that we will truly start finding the cure for cancer. So let me go over with you some basic guidelines on some things that you could do. Number 1, start eliminating added sugars and grains. So it should not be on what you look like. Because I remember I would probably have, I would say conservatively, about 350 grams of sugar growing up. I really would. No one knew how damaging it actually was, but I stayed skinny because I played sports and I was exercising all the time. I just so happened that I was sick all the time and I was chronically inflamed in almost every single joint. So you guys should be eliminating added sugars and grains. Please stay away from those. Guys, grains really are not lending anything to your life, but Dr. Nate, it has nutrition in it. You can get your nutrition from something else that isn't spiking your insulin. And not only that, is that most grains have phytic acid in them, which actually are considered anti-nutrients. Men, number 2, men, you should do a 3-day water fast every 3 months. Men, let me say it again, you should be doing a 3-day water fast every 3 months. Last year, I did a 2 3-day water fast, I did a 4-day, and I did a 6-day water fast every single quarter of the year. Why should you do that? To reset your insulin levels. Ladies, please don't ask me, can I fast? Because we do not recommend it for women who are actively having a menstrual cycle, and possibly women who are postmenopausal possibly could. But you got to remember is that men and women's hormones are going to be different. But men, you should be doing a 3-day fast every 3 months of just having water and then supplementing with some potassium, some magnesium, and some sea salt, okay? When people say, oh, I can never ever do that, well, guys, do it once. Yes, it can be very painful, but the more that you do it, it's not really that big of a deal, okay? Number 3, this has to do with your insulin levels, is start doing high intensity exercise and multi-joint weight training 3 to 4 times per week. High intensity exercise, multi-joint weight training 3 to 4 times a week. And I tell you what, combine multi-joint weight training with your high intensity exercise. So gone are the days of running long distances, doing moderate intensity exercise. That really does not help your blood sugar levels. In fact, you can actually run your way into type 2 diabetes. So this should be fast, it should be intense, it really should average 8 to 12 minutes, it should leave you exhausted, it should leave you gassed, and yes, there are different situations that are different for a lot of people, because ladies, you should be following according to your menstrual cycle versus week 1, 2, 3, and 4. But generally speaking, especially for men, high intensity exercise, multi-joint weight training. What do I mean by that? I mean by doing things that require things like picking things up off the ground, pressing over the head, cleaning, hip hinging, squatting, things like that you need in everyday life. Number 4, you should be sleeping 7 to 9 hours in line with your circadian rhythm. One of the reasons why is because of melatonin. Melatonin is not your sleep hormone. Melatonin is your repair hormone, which is why you'll start to run into some issues when you have elevations in blood sugar, you're not sleeping enough, which is probably 9 out of 10 Americans, why they run into having so much oxidative damage and so much tissue damage. Melatonin is actually the repair hormone, and it is highest from about 10 o'clock to 6 o'clock in the morning. So you should be getting, men, 7 hours to 8 hours, ladies 8 to 9, sometimes even 10 if you're going through acute inflammatory issues that are going on, and it should be in line with circadian rhythm. And the reason why is there's a difference between getting 8 hours of sleep from 2 at night to 10 in the morning than at 10 at night till 6 in the morning. 10 at night to 6 in the morning is going to provide much more repair, much more recovery. Number 5, guys, start getting some testing. Food allergy testing, testing your inflammatory markers like C-reactive protein, testing your vitamin D, and you should be doing an immune panel at least 1 per year, and that's a good start. And this is actually, if someone said, there's no issues with me going on, everything is great, whatever, I have no issues going on, then I would be measuring those things every single year. And then number 6, as far as nutrition is concerned, we could go way into this and go way down a rabbit hole. I know some of you are going to chime in and they're going to say, well, what about this and what about this? Guys, these are some basic things. Guys, you should be eating liver. If you're not willing to eat 9 to 12 ounces of liver every single week, start taking a desiccated liver. You should be either measuring your vitamin D levels, either going out in the sun, or if you can't, you should be supplementing with additional vitamin D. And we've recommended vitamin D 5,000 IUs. I've had people take 50,000 IUs for a whole entire month because their vitamin D levels were so low. And yes, there's different scenarios that will play a role in vitamin D absorption. A lot of it has to do with your gallbladder and things like that, and with your liver health. And then another thing too, I actually take this every single day, is astragalus, okay? Astragalus is good for a lot of different reasons. It actually helps with the repair of disc tissue, helps with joints, but it also helps with stem cell proliferation. And when someone has low immune numbers, like low white blood cells in general, astragalus actually stimulates the bone marrow to produce more stem cells that then will differentiate within the thymus as things like CD4 cells, CD8 cells, things like that. So that's where those things differentiate. That's why they call them T cells, because they differentiate within the thymus. And so astragalus is a wonderful, wonderful herb that can start to increase your stem cell production. And then the last thing I will tell you is always test. Make sure, guys, that you are working with a Wellness Way doctor who knows how to test for those things, because there's even some other tests that you can look at, things like carcinogenic embryonic antigen that can see how quickly certain cells are actually growing inside the body. But we don't order that for every single person, because every person is different, every person is unique, every case is unique. When someone says, what is your protocol or what is your program, I look at them and I say, there is no protocol, there is no program, there's no detox protocol that we use, although we do detox, but everyone's a little bit different, and it's all based on testing as well. I will tell you this, is that I looked at one person and said, you have a heavy metal toxicity that's going on, you need a detox, but it's going to be different than the other person who needs to detox from a lot of really bad hormone metabolism issues. Both of them occur in the liver, but you stimulate those things completely differently, okay? So what is the cure for cancer? What is a cure for cancer? Well, I will tell you this, start living every day like you have it. Well, what do you mean by that, Dr. Nate? What do you mean live every day like you have cancer? Because when you look at someone who's got a cancer diagnosis, man, they will do what's necessary in order to live another 4 weeks, another 8 weeks, another 12 weeks. They'll make every doctor's appointment. They will, the doctor says jump and they say how high. We need to start living every day like you have cancer. That's not to say that we're living in fear every day, but we should be living empowered, meaning at the end of the day, when we lay our pillow down on the bed, or lay our head down on the pillow, we're saying, what did I do in order to move my family forward? What did I do in order to move my career forward? What did I do to move my mission forward? And what we all should be saying, what did I do today to move my health forward, to continue to get better, to continue to heal, because I have a great purpose in my life. That ain't happening if I'm sick. That ain't happening if I'm tired. That ain't happening if I'm dead. So we need to start living every day like we have it, rather than saying, you know what? The doctor will find it. By then there's going to be a cure. But we have seen time and time again that the best cure for cancer is to never get it in the first place. And to never get it in the first place is to live every day like you already have it. So guys, I hope you enjoyed that. Please share this as well. Guys, if you are from the Yorkville or from the Chicagoland area, coming up, yes, we are accepting new patients, limited. We have people who still reach out. We tell them, hey, please get to the inflammation talk. Our next one coming up is going to be pinned to the top of this page. I believe it's June 7th. And so guys, just like we said with cancer, inflammation is a spark that creates the oxidative damage that leads to tumor progression, but it also leads to weight loss resistance, infertility, thyroid disease, arthritis, type 2 diabetes, autoimmune conditions, and even hormone issues, hormone imbalance. You won't heal unless you first define what inflammation is, what your inflammatory triggers are, and allow the body to start lowering the inflammatory triggers. It is then and only then can you start to repair and can you start to rebuild. You have to start handling inflammation first. So if you're from the Chicagoland area, you're from the Yorkville area, please go to the top of this page. Please register for this in-person event. And we will see you guys June 7th at 6:15 at that event right here at Exemplify Health Center. This is an in-person event. People say, Dr. Nate, can you please do this as a webinar? Guys, there just is not the same energy. There's not the same atmosphere than when we do this as an in-person event. So guys, please make sure you get registered for it. And again, if you like this video, please make sure that you share it. with as many people as possible. I'm always sincerely humbled. I'm always honored when people want to share the information that I put out and the Wellness Way puts out in order to help people. Guys, we are going to change healthcare. I can promise you that. And I hope you come with me during that process. Where it's happening, we're making it happen. And I want you guys to join me for this wild ride. So I hope you guys have a great night, and we will catch up with you on Wednesday. I'm going to talk about the topic of monkeypox and some interesting stuff in regards to that. So we'll see you guys on Wednesday. Be well.